Welcome to another program in our Medicine and Society series. We're so glad today to have three of our most eminent doctors in the area of obesity here in Charlotte with us. This is Dr. Marlowe. Could you tell our audience a little bit more about where you're from?
Well, Dr. Thomas Marlowe, and I'm at Dr. Marlowe's Weight Loss Institute. I'm originally from Indiana and moved to Charlotte to open up my own practice, and I loved it here. It's
Great.
fantastic.
Great. And Dr. Mehta?
So I'm Dr. Shivani Mehta, and I am a pediatrician at Levine Children's Hospital. I work at Teen Health Connection and Myers Park Pediatrics Clinic, and I also work at the Healthy Child Advisory Team.
Okay, you're busy too, both of you. And Dr. Vollinger?
Yeah, David Vollinger, thank you for having us, Rosie. I am with Southeast Bariatric. I'm a bariatric surgeon. I have been very passionate about the treatment of obesity for a lot of years. I actually currently am the medical director of the Presbyterian Bariatric Center, which is what we're trying to treat the disease.
Trying to treat the disease. Okay, so let's get to this topic because I know our audience is going to be interested in it. I'm going to start with you, Dr. Marlowe, Tom, whatever, okay. We have a weight-obsessed society. Everybody's wanting to lose weight. I mean, one of the most popular TV shows is Biggest Loser, and everybody's got to see that every week. And it gets a bit, crazy at times. And all the magazines, all the newspapers, every day we're bombarded with this. And sometimes you get the impression that the information out there is a mixed bag. Some of it true, some of it false, some of it myth, some of it's fiction. Could you help us sort out all that data we get about weight loss?
Well, that's a very good question, and I'm glad you asked. There's at least 3 big myths that I want to tell you about. I have patients all the time who come to see me because they've been trying their hardest to lose weight, and they're failing because they're following the advice that's simply wrong. I have a great example. This young woman in her 40s had been going to the gym daily for at least an hour, maybe even 2, for about 10 years, carefully counting her calories so that she'd burn more than she ate and following all the general recommendations like eating oatmeal for breakfast, but she couldn't lose those last 20 pounds. She came to my office and we did some blood testing, and we found out that she was eating all the wrong foods. So after giving her the correct diet for her, she lost those 20 pounds in 3 months.
What were the wrong foods?
Well, it turned out that she had a problem called insulin resistance. And so the things like the oatmeal and the things like the whole grain breads that she'd been eating were actually thwarting her efforts to lose weight.
Oh my gosh.
So right now, this does a great job of illustrating, well actually, I should point this out, when we had her eating foods that were not contributing to her insulin resistance, we actually had her eating a diet where she's eating more than she was eating before. So that's really the first myth, which is the calories in, calories out myth.
Well, that's good to know because I thought that was true. So.
Well, that one's simply wrong, and we physicians have known this for a long time. Not only do foods matter, but what medications you take matter. We've known that certain medicines like prednisone or antidepressants or birth controls can cause you to gain weight, even if you don't change what you eat. And that leads me to the second biggest myth, which is it's all your own fault. I have another patient, she's a good example, she's in her 20s. She came to see me because she's been hungry her entire life. And we gave her a weight loss pill that blocks appetite. And in the first month, she came back to me absolutely thrilled because it was the first time in her entire life that she felt like she wasn't hungry. She's lost about 200 pounds at this point. And we physicians have helped many patients with this type of problem. We've known for a long time that there are hormones and neurotransmitters which are released by the body to tell you when you're full or to tell you to munch on food. If you crave chocolate once a month, you know what I'm talking about.
Once a month.
Daily?
Yes.
Well, I specialize in non-surgical weight loss, and there's lots of different pills we can use to help normalize those neurotransmitters. Studies have also proven that bypass surgery, like the ones that Dr. Vollinger does, actually cause improvements in those neurotransmitters. And so even though he doesn't use any medicines to help with weight loss, the surgery will actually reduce those neurotransmitters and reduce appetite also. So the third major myth is that it's hard to lose weight and keep it off. Now, everyone knows someone who's failed, and that kind of clouds our judgment. But the statistics really show that there's a very good success rate, and patients are doing really well. Dr. Wing at Brown University has collected data on people who've lost a significant amount of weight and kept it off long term. And she's collected the data on what type of habits these people have. And right now she has more than 10,000 patients enrolled. Mm-hmm. So we know that people have good success rates. Now I personally have struggled with weight loss, and it's been a lot more difficult for me than for other people. But most of my patients tell me that it's really very easy for them when they follow the right plan.
Well, that was very helpful because everything you said I thought was true. It just turned out to be false. So, got to learn something. Next question's for you, Dr. Bollinger. Okay, and it's along the same lines, a little bit of different twist. So we have an obesity epidemic. I mean, everything's an epidemic, and we've got one in obesity. And I was sort of wondering whether we're fatter collectively than people in other industrialized Western countries, or if that's true, why is it true? Could you kind of illuminate that?
Sure. Unfortunately, we are. And
fatter?
That's the simple. Yes, the United States has the largest, the highest rate of obesity than any of the developed countries.
I guess we are first, after all.
We certainly are first in that.
Yeah.
It's unfortunate, and I think there's a lot of reasons, and I'll back up by giving a few numbers about the problem. It's really dramatic, and if you look at the United States currently, 2/3 of our population is overweight. 1/3 of our population is obese.
What's the difference?
So overweight is, there's a class of obesity, and there's a number we use called a body mass index, or BMI, that doesn't only take into consideration weight, but it takes into consideration height, so it's a more balanced measurement. And if you look at the classes, the body mass index that's considered over 25, you'd be considered in the overweight or class 1 category. If your body mass index is 30 to 35 or 30 to 40, that you're considered in the class 2 or obese category. And if your body mass index is over 40, then you're considered in the class 3 or severe obese category. So what happens in that situation is that the higher your BMI, the more likely you are to develop obesity-related medical problems. The type 2 diabetes or glucose intolerance that Dr. Marlowe was mentioning, obstructive sleep apnea, hypertension, cardiovascular disease, a huge list, 60, 70 different diseases related to your obesity. So we've got a real problem. If you extrapolate that 5% severe obese, which we have 5% of our population severely obese.
Over 40 BMI.
Over a 40 BMI, that translates into about 150,000 people in the Charlotte metro area. So if you look at that over time, that's a 75% increase in just the last 20 years. So something's going on, and there's some severe problems. And it's not only in our adult population, but it's in our kids. If you look at our kids, we have almost 20% now of our adolescent population is obese. Almost unheard of. In fact, it's increased to 75% itself over the last 30 years. So what are we doing wrong? And I think it boils down to multiple factors, and hopefully we're going to be talking about some of the solutions to these factors. But I think the whys are certainly the Western diet. Tom alluded to it already, the high sugar, the high fats in our diet. Portion control. You remember remember we used to remember McDonald's years ago when we grew up. Well, think about a small fry. Think about that white bag of small fries. Don't see that anymore. It's the red box. It used to be the large French fry.
That's the starter.
Exactly, and that's where we start now. So the types of food that we're eating, the portions that we eat, the high sugar, the high processed. There's not as much. There hasn't been as much emphasis on natural whole foods. It's been what's easy, what's convenient, what's cheap, and in general, that's not the things that are most healthy for you. It's the chocolate cookies, it's the potato chips, it's the fast food. The other big issue is the sedentary society. We've changed the society. Technology has been tremendous. There's a lot of things that computers and TVs and things have done for us to allow us to be more advanced than ever before, but not from a weight loss standpoint. And what happens is we sit in front of the terminals, we're not as active as we used to be. Computer science in a lot of our schools has taken precedence over exercise.
Yes, I
Physical
agree.
activity. And I know we're going to talk about some of that in our schools now, but we've really lost that activity, that exercise, that bent for that in our society. So at the same time, we're not eating as well, we're eating more, we're moving less. And that's just that's a recipe for disaster. And it's why we're having a significant problem. Now, to be honest, while we're number one, there are a lot of countries that are right behind us.
Right.
There are at least 10 countries that have over 20% of a rate of obesity in their country, and Great Britain, Mexico being some examples of that. So we're not alone, and in fact, the World Health Organization has told us that there's about 1.5 billion with the B, overweight people in the world, and about 500 million obese people in the world, not showing any signs of slowing down. While we're fortunate in the United States, the trend has slowed over the last 5 years or so. If you look at the national data, if you look, we just had an article on the front page of the Charlotte Observer this week that said studies have shown we're going to increase from about 37% obese rate to maybe 42% in the next few years. Real major problem.
I've read that article too, and I was a bit surprised because there's been all this emphasis on health and wellness and so on and so forth, so it seems kind of counterintuitive that we're going to get worse before we, I suppose, hopefully get better.
No question. In fact, there are more, for the first time in the history of the world, there are more people with weight issues that are overweight than are underweight and starving.
Oh my gosh.
First time ever in the history of the world because of the changes in our diet and the changes in our lifestyle.
Well, Dr. Maida, could you tell us more about what goes on here in Mecklenburg County, in Charlotte, in terms of people looking for help with their weight problem? Are there some resources they can take advantage of? Could you tell us a bit about them?
Absolutely. So, you know, Mecklenburg County's done a really good job of realizing that this is a problem and deciding that we need to do something about it. There are a lot of agencies that have taken this on as a task of deciding how they're going to impact the community, how they're going to educate the community, and how they're going to create different programs within our network so that we can improve our children and adults' weight status in this area. I mentioned earlier about Healthy Weight, Healthy Child and the coalition that was formed. So that was a coalition of multiple stakeholders across our county, including schools, healthcare professionals, child care centers, faith-based organizations, local businesses, policymakers, all coming together to say, how are we going to fix this problem? Our children are becoming more obese, and we need to do something about it as soon as we can. And knowing well that it's not just going to be one person or one agency or one sector that's going to be able to fix the problem. And they came up with a blueprint for a healthier generation, which outlines different goals around physical activity and nutrition that we as a community related to Mecklenburg County in specifically, how we can actually address those different issues and work on those different goals. And from that, a lot of different agencies have come up with projects and ideas that can implement activities in different sectors.